we are going to learn biomechanics of cervical spine and just the review of it. In biomechanics, we have forward bending or flexion, backward bending or extension, side bending and rotation. This we can learn with spine model. So let's learn on the spine model. You can notice this is C1 to C7 vertebra. So if C1 to C7 vertebra is there and forward bending means flexion, so let's do flexion. If we do flexion of your cervical spine, so that time this is your facets, here your facet joint. See, this is very clear. So if we do forward flexion, guys, if we do forward flexion this way, so that time your facets are sliding up and forward on the facets below them. So this facets is sliding up, this is sliding up and forward facets below them. If I am doing exact opposite like extension, so that time you guys can notice here the facets are sliding down and back, down and back on facets below them, right? So same way if we do rotation, let's see the rotation. So if this is my right side, this is my left side. If I want to do right rotation, so I need to move left transverse process. Let's move that. So this is your left side I moved, so right rotation occur. So that time you guys can notice that your right side facet is going downward and backward. I will turn for you guys. So if I'm doing from this side, this is your 7, that is turning here, so that is moving down and back. See, down and backward. So that time your left C7 facet, that is coming up and forward, right? So basics is clear. Right rotation, right facet is going down and back, left is coming up and forward. Okay, so this is just for your cervical vertebrae basics biomechanics. Now we are going to learn biomechanics review for thoracic and lumbar spine. For that also forward bending, backward bending and side bending plus rotation is there. Side bending and rotation we will see in different slide. Let's learn this on the spine model. Let's take the example of T8 and T9 vertebra for forward flexion and backward extension. So here you can notice that if we do flexion, so if we are doing forward bending, so this is called your flexion. So this is your superior articular facet, this is your inferior articular facet. So this is superior vertebra, this is inferior vertebra. So superior facet, this is your superior facet, this is your inferior facet. So inferior facet of superior vertebra, that is going up, for this is flexion, right? If we are doing flexion, so that time inferior facets of superior vertebra, that is going forward this way, forward and anteriorly or superiorly on superior facet of inferior vertebra. This is your superior facet of inferior vertebra. So clear for this. Now let's take T8 and T9 for backward bending or extension. So if I'm doing same way like this, so that time your facet is closed. So here you guys can notice that the superior inferior facet of superior vertebra, that is coming back and down or postero-inferiorly, right? That is gliding inferiorly and posteriorly on superior facet of inferior vertebra. Okay, so this is clear with the biomechanics of spine model.
Now we are going to learn thoracic and lumbar spine basics biomechanics review for side bending and rotation. So let's learn this on the spine model.
To see side bending and rotation. So if I am bending on right side, for example, if I am bending this side, so that time you can notice that here everywhere our spinous process of T9, T8, you can see T7, they are going on left side. That means if I am bending right side, rotation will occur on left. Or if I am bending on left side, so rotation will occur on right. Okay, and let's take for facet example. If I am bending right, this is I am bending, so that time your right side facets, these are your right side facets. So right facets, right superior facet, that is, you can notice like here, so right superior facet, that is going downward, means posteriorly and inferiorly, and the left side facet, that is going upward. Here your left side facets, this is left facet, that is going upward and superiorly or anteriorly. Okay, so this is clear for you guys. This is very basics, and we need to learn this for our spine mobilization.
Let's see ribs biomechanics. This is the motion, this is lever, pump handle, bucket handle and caliper motions are there. So pump handle, that will occur in upper rib, bucket handle for middle rib, and caliper will occur in floating ribs. So this is some movement, and here it's the description. Let's see the movement first. If your vertebra are going in flexion, that called internal rib torsion, so that time your ribs is going down and forward, means ribs are coming this side, inside and downward. So vertebral flexion is occur, and here your expiration will happen. If we are going for extension of your vertebra, so that time external rib torsion will occur, and here you guys can notice that ribs are moving up and outward with vertebral extension. So that time inspiration will occur. If your movement lost is there for vertebra, so that will affect your rib. If your ribs is affected, your movement in vertebra is also affected. This is vice versa.
Let's learn the rule of 3 for thoracic spine. This will be easier to learn on your spine model. Now we are going to learn rule of 3 for your thoracic spine. So this is very important for our spine mobilization. So let's see. For this is your spinous process, this is your transverse process. Just remember the spinous and transverse process. So if we notice that this is our T1 vertebra, T2 and T3. So for T1, T2, T3 and especially your T12 vertebra. So for that your spinous process should be at the level of your transverse process. You can see like a wing, so three wing, so that is your transverse, this is your spinous. For T1, T2, T3 and back to T12, the spinous process are at the level of, this is your spinous process, are at the level of your transverse process, and that will be like orientation for 60 degrees. So if you see, it's like oriented to the 60 faces, oriented on 60 degree, and for cervical it is 45 degree, and for lumbar that is straight ahead. So 90-degree angle that is making here. And if you guys can just remember with the face, like I just remember like this. If for cervical, so this is 45, 60 and 90. If we want to learn facet orientation, right? So how we can remember this in very easy way? Just remember 45, 45 degree, this is for your cervical, 60 degree for your thoracic and 90 degree for your lumbar. That's it. Just 45, 60, 90. So this will be the easiest way to remember the facets orientation.
Let's learn basic of motion, how flexion is affect your facet, extension, left rotation, right lateral flexion and left lateral flexion on the spine model.
If I'm doing flexion, so this is your flexion, so that time your facets are open. If I'm doing extension, so that time you guys can notice your facets are closed. So same way for rotation, if I'm doing, this is your left side, this is your right side. So if I'm doing right rotation, okay, this is right rotation, so I need to mobilize from left side. So if I'm doing right rotation, so that time let's see here on the thoracic vertebrae, so it will be easy to see. So if I'm doing rotation to right side, so that time here we can notice that our right rotation, so your T8 facet is closed here. Okay, right rotation, left facet is closed, but simultaneously we can notice that, let me turn for you guys, here your facet is open. Okay, so your facet is, this facet is open to right side. Same way if we are doing left rotation, let's take left rotation. So if I'm taking the left side, okay, so if I'm doing left rotation, so here you can notice that in left rotation your left side facet is open, but your right side facet, here you guys can see that this is your right side facet, so that is closed. And let's take for right lateral and left lateral flexion. So if we are doing lateral flexion or side bending, so that time we can notice that same side bending and opposite side rotation, T8 and T7 level. So if I am bending on right side, okay, so if I am bending on right side, the right guy is closed, right, and the left guy is open or elongate. So same way if I am turning this on opposite side, means left side if I am doing, so you guys can notice that the left facet is closed and the right facet is open for side bending or lateral flexion. Okay, here it is open. See, my finger is going, it's open.
Let's learn hand placement for mobilization. So for flexion extension, spinous process, for rotation and side bending in unilateral, on the transverse process on one side. For bilateral, means you have to keep your hands bilaterally on your transverse process. This will be very easy to learn in your spine model.
If I want to do gross flexion C2, so for flexion I need to keep my hand on the spinous process, and for extension also I need to keep my hand on spinous process. So flexion and extension we have to keep our hand on spinous process, and we have to just give the small oscillation, or at which grade we need to give, that we have to decide according to the patient condition, and then we can give the mobilization. But for flexion and extension we have to keep our hand on spinous process for mobilization. Okay, this is for flexion and this way trapezius should stand, and for extension it's like this. You guys can notice for extension like this way I can mobilize. Okay, and if I'm doing for example, if I want to improve rotation, so I have to keep my hand on the transverse process. So earlier videos we have already seen that if I want to do rotation, so I'm keeping my rotation to left side, so I'm keeping my hand on the transverse process of right side, and then I'm mobilizing, so that will move to left side. And if I want to do on the right side, so I need to come here and I need to stand this side, and then I need to mobilize this way, so your rotation will occur towards right side. Let me come on that side and show you guys. If I want to do rotation on right side, so I have to come opposite side, so I came on the left side. Now I'm keeping my hand on the left transverse process, and then I'm mobilizing it. So here you guys can notice right side rotation will occur. Okay, if we want to do unilateral or bilateral, that depends on patient condition. So for rotation, if the bilateral rotation is affected, then we have to keep the bilaterally, hands should be bilaterally like this and like this way. And if we want to do unilaterally, so hand should be like this on your transverse process. Okay,
Let's learn mobilization concepts. So for flexion and open restriction, where we have to stabilize, for extension or closed restriction, where we have to stabilize and mobilize. And if we are doing gapping manipulation or rotational manipulation, so for that we have to do cervical flexion. If we are doing translational mobilization or closing mobilization or manipulation, for that we have to do cervical extension. This will be easier if we learn on the spine model. So for flexion, stabilize inferior vertebra and mobilize superior vertebra, so that will facilitate anterosuperior translation of your facet. So we use upglide. For extension or closed restriction, we have to stabilize superior vertebrae and mobilize inferior vertebrae, so that facilitate down and posterior translation. So use downglide for that. Let's learn on the spine model.
guys, for thoracic I'm gonna take T7, T8 level for flexion and extension restriction. So just take that if the patient is having problem with flexion restriction or opening restriction on T7 and T8, so that time I'm gonna stabilize T8 and mobilize T7. Okay, and for rotation same way we can if I have left problem, I will mobilize from right side. If I'm right rotation problem, I'm gonna mobilize from left side. And for lumbar region, if we notice like L2 and L3 level, okay, so I have problem with flexion and extension restriction. So for flexion I'm gonna mobilize L2, and for extension I'm gonna mobilize L3. Why? Because for flexion we are going to mobilize superior vertebra, and for extension we are going to mobilize inferior vertebra. Okay, and for side bending and rotation, remember that if I want to improve left side, I'm gonna mobilize from this side, and if I have problem with right side, I'm gonna mobilize from left side. Okay, so this is all about your cervical, thoracic and lumbar spine mobilization. So this we can apply it for a different level. So here you guys can learn that while mobilization, let's take another example for T6 and T7 level. So if I have a problem with T6 or T7 level, so that time how we can mobilize or stabilize some vertebra. So just remember the rule of 3. So for T6 and T7, so here you can notice that patient is having T6 and 7, so it's T6 transverse process and the spinous process. So for T6 spinous process, that is 1/2 level below of your transverse process, and for T7 that is 1 full level below of your transverse process. Your spinous is 1 full level below, and here your spinous is 1/2 level below. So if you are remembering this stuff, then only you will be able to mobilize this vertebra. Okay, so if I want to improve flexion, so I'm gonna mobilize T6 and stabilize T7, and for extension, mobilization of T7 and stabilize T6. Okay guys?
Thanks for watching, and for future videos don't forget to subscribe. If you have any doubts related to topics in physical therapy exams, please let me know in my comment section so I can make a series of the videos on that. Till that time, stay positive. Bye bye.